It begins with a silence most couples never talk about, a question that hides in the shadows of every intimate moment. A question that sounds simple, almost harmless, but carries tension strong enough to shake relationships. Can precum cause pregnancy? Many search for quick answers, but very few understand the full truth. Tonight, I want you to imagine a young couple sitting in front of me in the clinic, their faces tight with worry, their voices low, their hearts pounding with fear. And the cause was one incident: pre-ejaculate. One drop, one moment they thought was safe. And suddenly, their entire future felt uncertain. This story is far more real than you may believe. Because millions of men across the world misunderstand precum. Some assume it's harmless. Some assume it contains sperm every time. Some believe withdrawal method is foolproof. And some discover the truth far too late. But the real suspense starts when you understand what is happening inside the male reproductive system, silently, invisibly, unpredictably. I'm Dr. Ayurmoolam, and today we are going to walk through one of the most ignored and misunderstood topics in sexual health: male infertility linked with precum. We'll explore whether precum can actually cause pregnancy, what science says, what Ayurveda explains, how symptoms appear, how diagnosis works, what treatment is possible, and what mistakes can destroy male fertility without warning. This video is not just another explanation. This is a journey into the hidden mechanics of the male body, a journey into mistakes couples make out of lack of knowledge. And this journey might even change how you look at sexual health forever. You may have heard this line somewhere: "It was just precum, there was no ejaculation." But sitting across from me was a couple who had believed the exact same thing. The girl had missed her period. The boy kept saying he never ejaculated inside. He genuinely believed withdrawal method was enough. And as they waited for the test results, I could see two lives suspended in panic. Their story is not unique. It reflects the confusion of millions. But before diving deep, you need to know what precum truly is, what it contains, how unpredictable it can be, and how ignoring its risks can lead to infertility confusion, unexpected pregnancies, or emotional stress. Men rarely notice symptoms linked with precum because it is not something that causes pain. It doesn't change color. It doesn't appear abnormal. It simply appears when a man gets aroused, a clear, slippery fluid from the Cowper's gland. Most men don't consider it important, but in the clinic, I see consequences that come from misunderstanding it. The first symptom men often ignore is inconsistent fertility. 1 month, everything looks normal. Another month, pregnancy happens unexpectedly or does not happen at all. Partners get confused and think something is wrong with the woman, but sometimes the root cause is the man's fluid regulation, including what leaks before ejaculation. Women, on the other hand, come with a different range of symptoms after unprotected intercourse where precum was involved. Missed periods, anxiety, light spotting, sometimes nausea, and many don't even know whether the fluid involved was sperm-rich or sperm-free. Doctors may observe stress, hormonal imbalance caused by fear, sometimes even irritation or infection if the intercourse was unprotected in an unsafe environment. But physical symptoms don't tell the full story. The real warning signs lie inside the reproductive system. To understand this, you must know the causes. Let's explore what precum actually is. Scientifically, precum, or pre-ejaculate, is a lubrication fluid produced by the Cowper's gland. Its job is simple: neutralize the acidity in the urethra and assist sperm travel. But here's the suspense. Precum itself does not contain sperm. Yes, medically, the Cowper's gland does not produce sperm. But the unpredictable twist is that sperm can leak into precum due to leftover sperm in the urethra. Imagine the urethra as a tunnel. After ejaculation, sometimes a few sperm remain in the tunnel. When a man gets aroused again, precum passes through the same tunnel and can pick up leftover sperm, carrying them along. This is why some men produce precum with no sperm, and some men produce precum with active sperm even without ejaculation. And here lies the unpredictability. No test can tell a man whether his precum contains sperm every time, some of the time, or never. That uncertainty alone is enough to cause accidental pregnancies. From an Ayurveda perspective, male reproductive fluid is built upon the seventh dhatu. Its purity depends on diet, lifestyle, stress, hormonal balance, and sexual habits. When a man engages in frequent incomplete intercourse or premature withdrawal as a habit, it can disturb the natural flow of Shukra Dhatu. This disturbance can cause irregular release patterns, meaning some men may unknowingly leak more active elements through precum due to weakened muscular control of the reproductive pathway. Ayurveda also explains that heat, excessive masturbation, alcohol, and poor sleep weaken the channels that control semen movement. When these channels lose strength, unwanted leakage becomes more common. In simple words, a man with weakened reproductive energy may produce precum that carries higher reproductive potency than expected. Modern science and Ayurveda meet at one point: unpredictability. You cannot fully control or predict what your body will release. And many couples learn this truth the hard way. Diagnosis becomes essential when a couple faces issues either direction: pregnancy occurring unexpectedly or infertility remaining unexplained. When couples visit me, I usually begin with a semen analysis, not just for semen count, but also for fluid quality, sperm motility, and structural health. While precum cannot be directly tested in routine labs for sperm consistently, semen analysis reveals the man's reproductive strength. We also conduct hormone tests such as testosterone, prolactin, FSH, and LH. In some cases, we check for infections that might cause urethral irritation and leakage. Ayurveda assessment includes studying diet habits, digestion quality, sleep cycle, and emotional factors that affect reproductive dhatu. If a man has a habit of depending on withdrawal method or experiences frequent leakage during arousal, it becomes important to evaluate the health of the glandular system. When should couples seek help? When a pregnancy scare repeats multiple times, when infertility continues without a clear reason, when ejaculation control is poor, when precum leakage feels excessive, or when anxiety around sexual habits becomes overwhelming. Diagnosis is not just about finding problems. It brings clarity, removes fear, and corrects lifestyle mistakes that silently damage fertility. Let's move towards solutions. We break treatment into 4 parts: diet, exercise, medicines or supplements, and lifestyle or Ayurveda-based improvements. Men often undermine how much food affects reproductive health, but diet is the foundation of Shukra Dhatu and modern sperm production. A sperm cycle takes about 70 to 90 days to improve, so what you eat today affects your fertility 2 to 3 months later. Foods that support sperm include almonds, walnuts, pumpkin seeds, black raisins, dates, cow's ghee, pomegranate, banana, and warm milk with ashwagandha. Zinc-rich foods like pumpkin seeds help regulate testosterone. Omega-3 foods improve sperm movement. Men should avoid processed foods, cold drinks, excessive sugar, and alcohol, because these weaken reproductive vitality and affect precum composition. Exercise plays a huge role. Men with weak pelvic muscles often experience poor control over fluid release. Strengthening pelvic floor muscles improves ejaculation control, reduces unnecessary leakage, and supports healthier sexual performance. Regular walking improves blood circulation to reproductive organs. Yoga poses like Vajrasana, Paschimottanasana, and Surya Namaskar balance hormonal flow. Meditation reduces stress, and stress alone can disrupt the reproductive system enough to alter both semen and precum patterns. A man who manages his stress well usually experiences better sexual performance, stronger erections, and more stable reproductive function. Medicines and supplements depend on the individual. Ashwagandha strengthens reproductive dhatu. Shatavari and Gokshura enhance vitality. Ayurveda formulations like Chandrapravavati or Shilajit help in glandular support and stamina. Modern supplements include zinc, vitamin D, CoQ10, and L-carnitine, which support sperm quality. But none of these should be taken blindly. Each body needs different support based on diagnosis. In men with infections, antibiotics may be required. In men with hormonal imbalance, targeted treatment works better. In men with low testosterone, lifestyle correction often helps more than pills. Lifestyle and Ayurveda tips form the final and most important part. Men must avoid excessive heat to the pelvic area. This means no hot baths, no keeping laptops on lap, and avoiding tight underwear. Sleep is the hidden medicine. A man who sleeps less than 6 hours often experiences a hormonal crash affecting sexual function. Ayurveda recommends regular sleep, mindful eating, and minimizing sexual overstimulation. This includes avoiding pornography addiction, which weakens reproductive channels over time. Massaging the lower abdomen with warm sesame oil improves circulation. Drinking Girardenia fennel water reduces inflammation in the urinary tract. Practicing controlled breathing improves nervous system balance, which supports ejaculation regulation. This is important because precum leakage is partly a reflex response. A stronger nervous system means better control. Let's look at what men and couples should do and not do. Do maintain hydration. Do stay active. Do have protected intercourse if pregnancy is not desired. Do follow a balanced diet. Do monitor reproductive health yearly. Don't rely on withdrawal method. Don't smoke. Don't drink excessively. Don't ignore stress. And most importantly, don't assume precum is harmless. Prevention and long-term care are simple. Build a routine. Warm water in the morning. A nutrient-dense breakfast. Light exercise daily. A glass of milk with ashwagandha at night. Limit phone usage late at night. Keep emotional health strong, and practice protected intercourse unless both partners intentionally plan pregnancy. Understanding your body prevents accidents. Ignoring it creates suspense you never asked for. Now imagine the same couple again, sitting in fear, waiting for results. They represent millions who never understood precum. The test result finally arrived, negative. No pregnancy that time. They sighed in relief. But they both agreed they never wanted to face that panic again. They learned a lesson that day, a lesson every couple must learn. Precum can cause pregnancy, not always, not every time, but unpredictably. And unpredictability is enough reason to stay informed and protected. When you understand your body, you protect your health, your future, and your peace of mind. If you found this explanation helpful, make sure to like the video, share it with someone who needs clarity, and subscribe to the channel Dr. Ayurmoolam for more medically accurate and simple health reasoning.